Hello, everybody out there on Facebook and social media. It's Jeff with Gasser Dental, and I'm here today with Lenora. And Lenora has an amazing story. She's actually our patient of the month because her teeth are so beautiful.
Yay.
And yay! And she's doing so good, keeping everything healthy and beautiful. So, Lenora, can you tell me a little bit about your dental history and what led you to Gasser Dental?
Well, at my age, it's a long story.
We have a little bit of time.
No, I started having to, I was involved in an automobile accident in the early 90s, and all of my front teeth were damaged. I used to have pretty beautiful teeth, according to my mom, when I was a child, and until that wreck. But anyway, it started me. Then I had to get all crowns, went to a good dentist in Idaho that specialized in cosmetic dentistry. But 6 years later, these two particular teeth right here had been pushed up. Anyway, they had to be replaced, and the cost in this country, I was like, and I'm in Quartzsite, Arizona half the year, which is close to the Mexican border.
Right.
And so Mexican dentist was recommended to me, and he was one of the first that was doing implants across the border in Algodones, Mexico.
Okay.
So went to this guy, got 2 implants, was real happy with them, of course, because I can't, it's like Dr. Gasser said, I couldn't see what he did.
Exactly.
I just saw the end result, what it looks like in the mirror.
Right.
And, you know, and then it looked great.
Did they do a sinus graft?
He did some sort of bone graft.
Mm-hmm.
And they did the implants, and they worked out fine. But anyway, another dentist I went to, then I had problems with these 2 crowns. So I went into a different dentist that he recommended that was next door to his office, the Mexican dentist.
Okay.
And she went in and did impressions, and she was going to do the 2 front crowns to replace those. I didn't realize what was going on. When you're laying there with your mouth open, and your mouth and your face is all sedated, you can't feel anything.
Right.
And I don't understand Spanish. And so you've got 2 or 3 people over the top of you, and your mouth's dead, and they're speaking Spanish, and sometimes they've got worried looks on their faces, and you don't have a clue as to what's going on.
Right.
So I went in there to have these 2 crowns put on, and I didn't realize what she was doing, but I guess the crowns were ill-fitting, and instead of having me come back and having different crowns made, they ground my bottom teeth here down to where you could see, what is that in the middle of your teeth, dentin or something?
Mm-hmm.
You could see brown spots on the top of like 5 of my bottom teeth. And I got out of this, she gave me the mirror, and I looked at it, I'm like, what? I mean, what do you do? It's done. I just thought she was polishing or doing something, but anyway, there's just...
It was a nightmare. It sounds very
Well, it's just 20 years of getting dental work done in Mexico, and you think you're saving money, and you are in the short term.
Yes.
But like I said, when Dr. Gasser removed these 2, the kind of hardware they use that they're implanting in the bones of your face is really important, what it is.
Yes.
And he said he didn't even know what the metal was.
Wow.
That had been put in there.
Used as an implant.
And I noticed Dr. Gasser's got a running video bragging about the type of hardware that he uses.
Absolutely.
To do work in people's mouths. He's not trying to cut corners on that.
Right. We
That's
only
what you're
use
gonna
Nobel
get.
implants.
Is that
yes.
what I just didn't remember the name of it? But so the final straw, I guess, in Mexico. This is 20 years of saving money in Mexico. I needed an implant on this side, this canine or whatever upper. And I went in there, and he did an extraction in Mexico. Did a bone graft, said see you in 6 months, and I came back, you know, went back to the Northwest, came back down here, and it was actually about 7 months, and went to his office, and he started doing the implant, and I jerked away from him. Again, there were 3 guys in the office, at least 2 of them spoke English, but I pulled away because it just stung. It didn't really hurt. And so he said, did that hurt? And I was like, no, just get it over, you know, keep going. Yeah. And then you know, I didn't mean to, but I pulled away from him again because it was just a little sting. He just quit, left the office, and his 2 little assistant guys started packing this full of bone graft, I guess. It did, because I didn't know, sewed it up and said, see you in 6 months, and sent me, didn't charge me any money or anything. I should have been really worried about that.
Yes.
And so for a couple of days after that, I mean, I couldn't even work. My face was like huge and it was bruised and it was just awful. Got over that. Went back to Oregon, came back, you know, or anyway, and went back for them, did not go back, had just gotten back down here to Arizona. And I was working in my store and I had 2 girlfriends in there. And I was bending down often to get something from the floor. I was weighing and pricing rocks, but my neck had been sore all day and not really paying any attention to it, but it was really getting bad. So I reached up and touched it, and there was a big knot down here.
Oh my.
And my girlfriend from Idaho does search and rescue. She had just recently lost a friend that had something going on dental. He didn't even know, because by the time you get nerves removed and you get, you know, crowns and all that, you can't feel when it's sick.
Right.
And sometimes there's no odor. I mean, you can't really feel when there's bad dental work or dental work that needs to be done. And she lost it. This friend of hers went to the emergency room one night. His wife took him, and frankly, he was dead less than 2 days later because his sepsis, I think is what it's called, in his blood.
Oh my goodness.
And so when I told her about that, I mean, she just like basically freaked out. So she went online. I said, find me the best dentist. I don't care about cost or anything. I was scared then. And definitely not ever going back to Mexico again, because I was sure it was related to all this mystery bone graft. Who even knows what's in that stuff, too? That's another thing you don't think about.
Right.
There are rules and regulations about things like that in this country. And I'm not saying there aren't good dentists in Mexico. That's not what I'm saying. But doing border town dentistry with nobody has any malpractice insurance. There's a new dentist in these different offices every time you go, you know, I mean, it's like, you know, they're handing out business cards. You make a deal to go to this dentist or that. It's really not safe.
It isn't.
What is safe about that? And then I had another friend say, well, you could save, you know, $5,000, $10,000 by going to Costa Rica. And I said, there you go again.
Right.
I don't speak Spanish. I want somebody with malpractice insurance, somebody with a good reputation, somebody that actually cares about what they're doing, and somebody that's an artist.
Yeah.
Dr. Gasser, I mean, he's been on morning talk show radios trying to educate people about this. And it's just, okay, enough of that. I am so happy that I, you know, when you think about it, you think, oh my gosh, I'm not going to spend that much money. But you know what? Are you worth it?
Exactly.
Really? And I made an appointment to go on with the procedure to get the all-in-4 top and bottom. And the next morning, my older son from Montana called me. He said, Mom, don't you do it? I said, what? He said, don't you do it. He said, I know you're thinking about backing out because you don't want to spend any money. And I was like, you know. And so I just stepped out and did it. And really, it's the best thing I've ever done for myself. It really is.
Absolutely.
It is. I mean, after it's all said and done, I thought my teeth were good as a child, but everything fits so perfectly, and it's so pretty.
Beautiful.
And I don't even have to think about, you know, there was a long time there, a couple of different times after the car wreck, waiting for these implants where I was so aware, because I work with the public, I'm not smiling.
Yeah.
And finally somebody said, quit putting your hand in front of your face. So I just try to not smile, you know. Probably contributed to my wrinkles I got going here. But, but anyway, I'm okay with those. Otherwise I have something done. But I'm just, if you're thinking about it, do it.
It changes your life.
It changed my life.
Yeah. And you have to feel better health-wise.
Well, I do. Oh, another thing. That's a really important part. I'm real good about going in for my wellness exam and doing my, you know, my mammos, all the stuff that we're supposed to do once a year. And I've always been really good about staying on top of that. But for years, I have really low blood pressure good. I have my pulse is great. But my white blood cell count will be a little bit elevated. And the doctor would always say the same thing. Well, only thing I see, your white blood cell count's a little bit elevated. You're probably coming down with something. Every year, probably coming down with something. And I was like, well, maybe that's just, you know, the way that it is, you know, with my blood or something. Well, guess what? I told Dr. Gasser after we began this procedure, and I had all of the sick teeth, and some of them I didn't even know that they were, out of my mouth, and I went in for my wellness exams. Guess what?
The white blood cell
Well, I've had
count was good.
2 wellness exams now. No elevated white blood cell count.
Wow, that's amazing.
And it's just, you know, having that like that in sickness in your body anywhere can contribute, from what I've read, to like even cancer. I mean, you're sick in there, and your body is constantly fighting that. And
that infection.
And it's just not healthy.
Wow. Well, thank you, Lenora. What a wonderful story.
Yeah, what a monologue, huh?
Well, congratulations on being our patient of the month. Let's see the smile. Show them. Nice.
Hi, everybody.
Awesome.
If you're thinking about it, just do it. Come see Dr. Gasser. I'm serious. The guy's a pro.
Awesome.
You know, wait. One girl, when I was first coming in, she said, you know why I've worked in here for 20 years? Partly. And I said, why is that? She said, because Dr. Gasser is such a perfectionist.
He is. Yeah.
And that is what I have come to know. So.
Yeah. He doesn't stop until the patient's happy.
See, everybody's going to think I'm getting paid for this. Hey, guys, this is really, I'm not. I'm so happy with my mouth now.
Yes.
I mean it. It's
absolutely.
Just feels like a miracle. Okay.
Thank you. Bye-bye.